We're still in the upper extremities. We'll have a brief review of the arm right here, because there were some structures that we have failed to identify in the previous video. So just to review, large muscle right here is biceps brachii. Particularly, this is the short head of the muscle, and on the deep side of the muscle you can see the musculocutaneous nerve right there and its branches going to the muscle, the actual belly of the biceps brachii. And then this large nerve right here, that's the median nerve, which does not innervate anything in the arm region. It will course down, and it will supply the anterior aspect or compartment of the forearm. So we have the brachial artery right there. Alongside the artery is the brachial vein. At this level, the brachial vein is joined by the basilic vein, and it they will form together the axillary vein. And let me point out, there are branches coming from the brachial artery. Particularly, we have one right here. That is one of the collateral arteries. The collateral arteries we have on the radial side, so that is one of the radial collateral arteries. And we also have on the ulnar side. They are quite difficult to really expose and preserve during dissection. So distally, these collateral arteries, the one on the radial side, it will form an anastomosis with the radial artery here in the forearm. And conversely, on the ulnar side, it will form an anastomosis with the ulnar artery on the forearm. So those collateral vessels are important because when the elbow joint is flexed, the main, the large artery, the brachial artery, is kinked, or it is folded. So there will be compromise of blood flow through the brachial artery. So blood should have an alternative pathway to reach the forearm and the wrist and hand, and that is provided by the collaterals. So let's follow the brachial artery going down. Not sure if you can see clearly, but at this level, you can see the bifurcation of the brachial artery, forming the radial artery and the ulnar artery right there. Then we can see the tributaries to the brachial vein also at this level, and that will be the radial and ulnar veins respectively. That's the median cubital vein. Again, it provides anastomosis between cephalic and basilic veins, the superficial veins of the upper extremities. Okay, at this point, at this area here, you can see the bicipital aponeurosis. Then we move down to our forearm. starting with the anterior compartment structures. The anterior forearm, no, the muscles here, we can organize into 3 layers: superficial, intermediate, and deep. And right now, we are looking at mainly superficial layer of muscles. No? Then we can also see the tributaries to the superficial veins. No? So let's start with our muscles. This large muscle right here, that is flexor carpi radialis. No? It is wrist flexor muscle, no? On the radial side of the forearm. And then this one, you have a small thin muscle with a very long tendon. Also one of the wrist flexor muscles, no? That's the palmaris longus. No? Try to follow, no? And trace the tendon, the long tendon of this muscle. Sometimes this muscle may be absent, no? In some people. In clinical significance, the muscle and its long tendon can actually be harvested and used as a graft, no, to fix torn or damaged ligaments, no, in other parts of the body, like the cruciate ligaments inside the knee joint. And that will be discussed in another topic, no, in another video set. So the muscle here, that is flexor digitorum superficialis, no? The superficial group or set of flexor for the fingers or the digits. And then here, ulnar side, this is flexor carpi ulnaris. So the nerve that you can see right there, related on the deep aspect of flexor carpi ulnaris, that is the ulnar nerve. The intermediate, no, and deep layers of muscles are not really well exposed in this particular specimen. So we cannot really identify all of them. No? This one right here, related to the deep side of the flexor digitorum superficialis, that will be the median nerve. Median nerve. And then this one, this is the radial artery, the artery that we commonly palpate, no, to check for peripheral pulses, no, here at the wrist area.